Every patient experiences your physiological state before they experience your clinical expertise. Learning to regulate your own stress is not a luxury, it is an essential clinical skill that improves decision-making, enhances patient care, and protects your own well-being. Standard hospital wellness initiatives fail young doctors because they target psychological symptoms rather than the physiological root causes. Recommending relaxation techniques to a resident under surgical lights ignores the autonomic pressure of the environment. True relaxation requires a low-stakes environment. In an acute care setting, dropping your guard is impossible and medically inappropriate. Clinical work requires high-functioning alertness, not a meditative retreat. What is typically labeled as burnout is a measurable failure of autonomic nervous system regulation. It is a state of chronic depletion driven by continuous energy expenditure without adequate recovery. This grid plots autonomic nervous system activation against depletion and renewal. We can map clinical tasks directly onto the scale, breaking bad news, coding a patient, or navigating administrative burdens. These high activation events pull a provider's physiology into the depleting quadrant. A physician cannot eliminate the friction of a clinical shift. The external demands are fixed. The only manageable variable is the internal physiological response to those demands. The objective is not stress relief, but the maintenance of self-regulatory capacity. This capacity is what allows a clinician to preserve medical accuracy under pressure. When those demands go unmanaged, the sympathetic and parasympathetic branches of the autonomic nervous system fall out of harmony. The system desynchronizes, creating an erratic physiological rhythm. This desynchronization has an immediate effect on the brain. The erratic signals from the heart physically impede the prefrontal cortex, the center for executive function and complex decision making. An impaired prefrontal cortex translates to concrete clinical consequences. Triage decisions slow. Differential diagnosis become less precise. The probability of a diagnostic error increases. To mitigate these errors, the provider's autonomic state must be treated with the same empirical rigor applied to patient vitals. Data suggests that a provider's autonomic state is not confined to their own body. It acts as a transmissible factor within the therapeutic encounter. Managing the nervous system is the physiological foundation of effective care. It is the baseline upon which all other clinical skills are built. We measure this baseline through heart rate variability or HRV. It tracks the microsecond to microsecond changes in the time intervals between consecutive heartbeats. It is a common misconception that a healthy heart beats with the steady, predictable rhythm of a metronome. A healthy heart's rhythm is mathematically chaotic. Spacing between heartbeats constantly changes to meet challenges. This nonlinear complexity provides flexibility to rapidly cope with an uncertain environment. In contrast, chronic stress causes a loss of complexity. The rhythm becomes rigid, indicating reduced adaptability. Interpreting these metrics requires proper measurement context. Baseline HRV values must be adjusted for the subject's age, sex, and recording period length. Higher resting HRV reflects a flexible nervous system that can respond to stress effectively and return to balance more quickly. We can optimize this resilience through a state called psychophysiological coherence. This is a specific physiological alignment that is more complex than simple breathing exercises. Coherence is the constructive integration of cognitive and emotional systems. It results in high levels of mental and emotional stability. In this state, the two branches of the autonomic nervous system synchronize. This synchronization shifts the ANS balance toward increased parasympathetic activity. This chart shows the HRV pattern of frustration or anxiety. The data is jagged and erratic, showing nervous system desynchronization. But when a clinician generates a renewing emotional state like care, the pattern shifts. The jagged line smooths into a high amplitude sine wave reflecting ANS synchronization. Coherence is an active, high-performance state. It is an optimized mode of functioning that counteracts the depletion experienced during a medical shift. This leads to the study of relational energetics. This field examines how emotional states are encoded in physiological patterns and shared between individuals. The human heart generates a powerful rhythmic electromagnetic field. This field radiates outside the body and can be modulated by the individual's emotional state. Research indicates that the human nervous system is capable of detecting and decoding this energetic information from the heart fields of others. The HeartMath Institute conducted a study with pairs of subjects to measure how one person's coherence affects another's physiology. When the first subject sustained HRV coherence, the second subject's brain waves synchronized with their heartbeats. This alignment suggests a physical link. Closer analysis shows the EEG peaks locking into phase with the external ECG field. The heart's rhythm influences the nearby person's brain waves. This suggests that a coherent provider can help pull a patient's disorganized nervous system toward a more stable state. Conversely, an incoherent or stressed physician introduces erratic information into the therapeutic encounter. This can potentially influence the patient's own physiological state. Fulfilling the Hippocratic Oath to first do no harm includes managing this autonomic field to minimize physiological friction during patient care. In acute care settings, providers face constant, intense interactions with limited opportunities for recovery. This can be described using a leaky bucket model. Daily stressors act as multiple holes in the bucket, causing a continuous drain on the physician's energetic reserves. If these autonomic leaks are not addressed, the cumulative deficit reduces the provider's behavioral flexibility and capacity for care by the end of a shift. Formal recovery sessions are often impossible during clinical work. The solution is the micro-intervention, a protocol designed to halt this drain in the span of 1 or 2 minutes. The shift and reset mechanism is an ultra-short protocol used between clinical tasks to recalibrate the system. A clinician can consciously use the heart-focused breathing technique in the brief window before entering a patient's room. This intervention acts as a circuit breaker, stopping the sympathetic energy drain and shifting the HRV toward a coherent pattern. By recalibrating the autonomic baseline, the physician enters the encounter with improved mental clarity and a stabilizing physiological field. The nervous system you bring into the consultation is often the first treatment your patient receives. Every patient experiences your physiological state before they experience your clinical expertise. When you learn to regulate yourself, your mind becomes clearer, your presence becomes calmer, and your capacity to heal extends far beyond the prescriptions you write.